And what we did was to sit down and look to see what was possible. And one of the things that came immediately to mind is that having worked with the Earth Institute and the Millennium Villages, there were 2 villages in Nigeria, one in Ondo, one in Kaduna, and they had started this along with other villages in Africa. They clearly showed that there were results from the interventions they had on health, on education and agriculture. But the challenge we had was to say that we needed to make this more than about a village. Nigeria was about local governments. Local governments at that level had between 500,000 and maybe even 2 million people. And you were talking about 774 local governments. So the idea was, how do we do that? We were already going to the states, giving them grants, transferring monies to the states to spend on MDG-related activities. And we thought, why not with the local governments? Huge challenge. These were systems that were broken in terms of service delivery, but they were the closest to the people. And so what we did was to begin to look at a scale-up of the concept of the Millennium Villages that would situate itself in a local government setting, where government would take the responsibility of resourcing these interventions, and everybody else's best practice and the monies that they could bring in technical assistance or in specific interventions that may improve the spend of Nigeria's resources. We started that scale-up just about 2 years ago, in 2009. And it started first with buying ownership. And we talked to local government chairmen, we talked to parliamentarians, we talked to the governors, we talked to the communities. And most people were in disbelief. No, we cannot want to spend this kind of money here. There are no checks and balances. We've never seen government deliver service over the years here. How could we possibly think of wasting money? But we didn't. What we did was go back to the drawing board, hear the voices of the people, of civil servants, of government officials, of the parliamentarians, and come together with a scale-up of the Millennium Villages. It's a package that focuses on health and education because we believe that these are where the indices are worse. We don't ignore the empowerment issues around agriculture, economic empowerment, or water, the environment, but we try to pull those strands from the other interventions that are happening around the country. So the focus is health and it's education and it's at the local level. And we have the largest scale up in Nigeria in a very complicated environment. So technically speaking, the science is there. It's tried and tested. What we're actually going to be challenged by is the scale at which it's going to happen. This is going to cover 113 local governments all over Nigeria. It's going to end up having a coverage of 20 million people. From what we've seen so far, there's a lot of buy-in. There's more capacity than we thought. There's more response to wanting to try to do within government agencies. For the first time, different sectors are talking to each other because we're forcing the issue that development is not just about health on its own, that you've got to think about water and the gender issues and agriculture, education. They've got to be talking to one another, with one another, so that we get a much more enriched intervention and an outcome with our indices. So in terms of that planning process, we really began the work at the local government level. We connected them to the state government process so that you have some coherence around the programs and projects. And then we employed technical assistance that went into the local governments to help them with the Earth Institute team to develop the packages that we needed to invest in. I think that the MDGs for us are a solid foundation. They're not a ceiling. I expect that as we go to discuss the next set of development goals, that will reach for the ceiling of a developing country, that where everybody has an equal right to attain their potentials. Right now, we're just looking for the right to survive. And that's, you know, so miserable. It's such a crime that we say children cannot go to school. If they do, they don't have a teacher, there are no inputs. Worse still, that a woman who should be taking pleasure and looking forward to the birth of her child has to think about praying before she has that baby because she may not make it. The likelihood of many in the rural areas that they wouldn't. So these are the things that we take for granted everywhere else, but it's a basic right and we don't yet have that. So my expectations would be for government to come back to that position of delivering basic services, and that this opportunity we have for the scale-up would provide the proof of it, that you can do it, and you can do it in partnership, and it can yield results. What I see are the benefits of the Millennium Villages concept for us in our scale-up is that what we have put together is a coherent package of interventions. They may not be the maximum, but they are the minimum set of interventions that we would get the results that we expect against these indices that are horrible for health, for education, for poverty. And they're done in such a way that they can scale. And that's, I think, the beauty of what we have here is there's so many issues here that come together that you can see concretely in the packages around the Millennium Villages. And for us in Nigeria, we were very fortunate. We had 2 villages. And where we had naysayers amongst our parliamentarians who rightfully should be cynical about anything wanting to happen at the local government level, given the track record of government over the years, when they saw these 2 villages and what was possible over a period of 2 years, this inspired them to say, you know, we can try this all over the country and we can do bigger and better. And bigger and better meant the local governments. And that's the right way to go, because what you want to do is not to replace government, is to fix government to do what they're supposed to do, deliver to the people.